So assuming that the patient received 3 agents, and 2 of those were pemetrexed and bevacizumab, my recommendation would be to continue both pemetrexed and bevacizumab after the initial cycles. To me, maintenance therapy is a true no-brainer. At the end of your induction, however you define it, whatever drugs you've used, you then make an assessment. Did these drugs help the patient? And you can answer that yes or no using objective and subjective criteria of your own. You then can ask, is this drug safe at this point? And the third question is, does this drug make sense to the patient who's receiving it? And at the end of the induction, you ask those 3 questions. And if the answer to all those things are that it's effective, it's safe, and the patient feels it's helped them and makes sense for them and where they are in their lives, those drugs should be discontinued. And in the case of this patient, it would be continuing both pemetrexed and bevacizumab. There was a clinical trial done that looked at survival from the start of therapy for different kinds of maintenance, bev alone versus pem plus bev. But hidden in general, that did not change overall survival. But where the overall survival did change is for those patients eligible for maintenance. Those that got the 2 drugs, PEM and BEV over BEV alone, they had a median overall survival of a couple of months more, which is an important benefit in our patients. So maintenance makes great sense, and it should never be given unless you ask those 3 questions, and the answers are all yes. Did the patient's cancer shrink? Was the drug given safely? And did the patient feel that this was an appropriate treatment for them in their lifestyle?